All right, so that was a great talk. We're going to move on to our next speaker here, Dr. Heidi Suffoletto, talking about community-based CPR education programs. And she's going to be speaking with us in person here. So I'll just give a quick intro for her. Dr. Suffoletto is a dual certified in emergency medicine and primary care sports medicine, and is a clinical associate professor at the University of Buffalo Jacobs School of Medicine, where she serves as the director of sports medicine division in the Department of Emergency Medicine and as an associate program director for the primary care sports medicine fellowship. In addition to her clinical practice, she provides medical coverage for the NHL Buffalo Sabres and the NLL Buffalo Bandits, and works as an unaffiliated neurotrauma consultant for the NFL. She's also spent over 2 decades as a team physician for SUNY Erie Cats Athletics and serves as a medical expert on the advisory board for Project Play. Following the on-field cardiac arrest of Damar Hamlin in 2023, she's been a strong advocate for hands-only CPR training and has partnered with county government and the American Heart Association to train nearly 30,000 citizens in hands-only CPR. So welcome and joining Dr. Suffoletto.
So good afternoon, everybody. Last push toward a break, and thanks for having me. Like everyone before me, I've been at this for a while, so to see so many people that are dual EM/SM is really quite exciting. And this talk, if you just all heard Dr. Betts speak, was the inspiration, and we'll get into a little more of this. But this is going to talk about taking your very unique and amazing training in emergency and sports medicine and showing a way to push it into the community, and also for some academic research opportunities. So a little bit more relaxed, but it's been a lot of, it's been really interesting, our adventure over the past nearly 3 years. I need my talk, I think. This is a great talk to have fries at. Bring your sodium level up after the marathon talk. Yeah, that's it, I think.
This one?
Yeah, and then do I
Someone
scroll
else, there
through?
you go. Yeah.
Okay. So as you can see, I don't have just my name on, because much as we talk all the time about both sports medicine and emergency medicine as being a team sport, training 30,000 local people in hands-only CPR, and then the next efforts also as a team sport. And so this has been a partnership that's been amazing. I think you're going to see a little bit of repeat from Dr. Betts' talk, but I'm going to throw, in addition to hearts as being the H we're talking about today, the fifth as being helping or community helpers. And the invitation here is to bring this program home with you. And at the end, I would love to have anybody reach out if they want to bring any of the aspects of this to their home program. So we're going to talk today about our inspiration for our work, about how it all developed, and then how we've done CPR education, how we have started and spearheaded some AED access initiatives, and then some policy and advocacy. So the inspiration, Damar was obviously there first, and I'm going to say that though I could have been on the field had the game been in Buffalo, I wasn't, but it was against Buffalo. So like one of 21 million people, I was watching the game on TV from my living room, and we saw him go down, and I saw this medical staff that I know so well hop into action. We saw the CPR start fast. We saw the athletic trainer running down the sideline for an AED. And during this entire time, I'm in a group chat, like many of you may have been, with friends of mine that are all physicians, and every single one of them, he's dead, there's no chance. And I said, stop, wait a second. He had high quality CPR, and he had it fast. Much like, I work for my EM work, I am in a cardiovascular center of excellence. We get a lot of cardiac arrests. And when the EMS folks come in, one of my first questions is always, was their CPR started? When was it started? How long were they down for? Because I always know if it was started faster, my work's going to be more likely to be successful. So as I'm watching this evolve, I'm sitting there thinking, much like Dr. Betts said, when I get fangirl when I do my work in the NFL, and I say a lot of times to collapse on an NFL sideline or on a field, you might have a better outcome even then in the ER, because everybody's focused just on you. And so where this went was, well, why can't everybody have this? Why aren't more people trained just like all those people on the sideline were trained that day? Whether it was the trainer starting CPR, whether it was the medical staff working and coordinating, whether it was the other players forming a wall to give privacy. And the fact is, we know if you start CPR, your out of hospital cardiac arrest survival rate goes from 10% to 20 or 30%. It doubles to triples, it's just CPR. We also know that with an AED, it can go to 70 to 90. So these are everywhere. Let's get it done. And it led to even more issues with who's getting the CPR. So we reviewed the literature and we realized the numbers you see here in front of you. If you are a person of color, if you are of limited socioeconomic status, you are less likely to get CPR at home, which is where 80 to 85% of out of hospital arrests happen, or even in public. And so we wanted to fix that. So this was a goal of let's get the community healthier and let's try to break down some of the health equity issues. So step one from my end was a study through my ED where we said, let's figure out why people aren't, well, if they're doing this, if not, why they're not, and if not, can we get them to train? We all know there's boarding. We all know people are going to wait. And so the inspiration here was, could we get people who are patients waiting, not really sick patients, obviously, but patients waiting, or their family members waiting, but they're thinking about health. Can we get them to learn CPR? Can they watch a video while they're in the waiting room? Or I'm sorry, while they're waiting in their rooms? So we did this study. It was a multi-center trial, which had two of our local EDs, one of which is the one I work in, which is the Cardiac Center of Excellence. The other was an inner city trauma center. And then we did a third center in Augusta, spelled wrong, Georgia, where they were remote from DeMar. So would it be any different in their site where this wasn't, on every single news station and every single social media feed every day? And what we learned made sense. People didn't go because it took them time, because it cost them money, because they couldn't find a class. That was the barriers to learning to train. But then there was fear. I'll throw my husband under the bus in this. I've been an ER doctor at this point for 21 years, and I hadn't convinced him to train yet. And when I asked him why, he said, what if it doesn't work? I said, well, but what if it does? Well, it's not going to necessarily work if I do it either. And he said, yeah, but you're trained to handle that. And he was really afraid of it. And after DeMar, he did go get trained. So that was pretty cool. So as we're trying to develop how we're going to do this, the other aspect of it was Dr. Bassan, who was on the field that day and is our medical director. And he was thinking very action oriented as I'm starting the academics of, okay, we need to get to the people. How do we get to people where they're at? Well, wait a minute. We've got 40 athletic trainers. People trust their athletic trainers. They're with their athletic trainers, and they're, again, very health focused. So can we train the trainers? Can we turn our athletic trainers into people that would train the communities that they're in? So that was step one. Beyond that, then a whole lot of other people took notice, and we'll talk more about that later. So this is our timeline. January 2023, January 3rd to be specific, this all started. The ED study started in, I want to say March, we got our IRB approval. And during this timeline, we're starting to make our connections. We're getting some funded. And by June 2023, we did our first event in the community, which was at the Juneteenth celebration. Again, looking at this point for the health equity and to get into underserved locations. And let's meet the people where they're at. Later that summer, we got our first athletic trainers as AHA certified instructors. August was where we went into the Erie County Fair. Again, this is the community. This is people who may not have access, but they're there. Let's get 5 minutes of their time. So it progressed through. And over the last year, we've gotten grant funding from 3 or 4 different places. We've trained 180 instructors, I believe. And just last month, we surpassed, I guess November, we've surpassed 30,000 people trained in hands-only CPR. So this is the culmination of what we want to do. We want to, when we say, did they get CPR? We want the answer to be yes. And so we're trying to get out there and leverage our partnerships. So then it gets back into the research. How is the best way to do it? Is the best way to do it where people expect to train for CPR? That would be a setting like our athletic trainers calling families in. That would be a setting of, I trained all 100 of my junior college football players in it for the last 2 years in a row by asking their coaches to make it a part of their preseason sports. Those are your prepared things. Or is it more of a fair-like or fluid-like setting where they come to go to the Erie County Fair or they go to Juneteenth and, hey, there's a mannequin sitting on a table and someone wanting to teach me. I think every single one of you, if you learn the script, could teach someone how to do decent CPR in 5 minutes, and that's what we're doing. So our program goals here of the community part was to train members of the underserved community and to get our team, our sports med team involved in doing this. And then that expanded to being medical students, and it expanded to being athletic training students, and it expanded really everywhere. And so this is what we were talking about just now, and you can see the 2 different formats that we used, and we simplified our training. We really got into the no-go, right? They're not talking, they're not responding. start CPR, right? If the worst thing that's going to happen is you start and they wake up and smack you and say, what are you doing? You've won the game. That's fine. And so we're trying to simplify it. No pulse checks, because people who aren't trained to do that, and even some that are, it's hard to do that. So you're making sure that they're not breathing and that they're not responding, and then you start, and that's it. The cool thing and what we've learned is, how do we get people to do this, right? How do we get them more interested? If you are on a sideline, you're pretty interested. If you're not, maybe you're not. So we started saying, what can we do to incentivize people? And that's where this whole program really took off. We've now trained people. This is Western New York, the other side of this lovely state. And you can see where we've trained people. And this is how it's grown. And the spikes that you're seeing there, that June, July spike that you see is Juneteenth, and it's Erie County Fair. Again, massive amounts of people. And we just keep ticks. Every time somebody will listen to what we have to say and agree to push on a dummy, they get trained. And then it gets into, is this working? All right. So we did a community participation survey, and who's doing it? You can see the demographics here. And this is the one we're so proud of. Before we train them, you can see the number shot up by 30% on who feels comfortable doing it, and the number shot down by 30% on who didn't feel comfortable doing this, just based on the 5-minute training. So the feedback, we want to know, this is always about what can we do? How can we do it better? And so again, we are in this great place where we have our athletic training program at UB extremely involved. We have the Buffalo Black nurses extremely involved. We have black men in white coats extremely involved. And the goal was, they wanted this to turn into a mentorship program. And so we're getting initiatives, though, to pay the people that are training people, and some contests to incentivize people to get trained. We then decided that CPR wasn't enough. And this was one of the coolest things that we've done, is UB Buffalo does an initiative called the Social Justice Fellowship, has been renamed Community Engagement Fellowship to be a little bit more inclusive, but it incentivizes our medical students, our biomedical grad students, residents to apply for a social justice fellowship. It's funded by about $3,000 to $5,000, depending on what they need. But then they go in and they get involved in a project and a research project. And so last year, I was lucky enough to be a mentor to a student who partnered with Cardiac Crusade and Pulse Point, which is an app that we can talk a lot more about if you want. But the idea is that if you have a phone, you can go on your phone and say, hey, Siri, where's the nearest Starbucks? Ding, 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 ding. It pops up all over the place. We wanted to put it into a situation where you could say, hey, Siri, where's the nearest AED? Coming back to an earlier talk about those first 2 minutes matter the most. And oftentimes an AED nearby is going to be more effective than EMS. And so we got involved in a program to get these AEDs registered. And it's really cool because Pulse Point, you can go on and be a registrar without doing anything other than putting location. You can be a verifier if you want to do a little additional training. So to be a member of this contest, it was an adult that needed to verify, and whoever basically verified the most AEDs in a certain time period won prizes. So you can see that over the course of the year, we had kickoff parties, we had all sorts of funding things, but the end prize of this was going to be to win cash, right? You do this, you win cash. And so after it started, we had this great spike in events. And then what happened that was really cool is one of the people on our team is media involved. And what gets attention a lot of times? Media and social media. So they start putting this all over the place that we're doing this. And all of a sudden the AHA is interested in what we're doing. The Buffalo Bills clearly are very interested in what we're doing because it was all inspired by the event that happened to one of their players. And so they're like, what can we do? How can we help? And this led to actually a coalition of meetings where two prongs, the Bills saying, how can we help? And Erie County saying, wait a minute, we want to take advantage of this too, because they were looking to become a heart safe community. All of this is better for us in the ED, right? We're all happy when more people, there are 13 pillars of being a heart safe community. And 2 of them are AED accessibility and also 15% of your population trained in CPR. And so they partnered with us to help push this through. And it became a monthly meeting. And the Buffalo Bills said, well, what can we do? And lo and behold, this is last year when we were still in the playoffs, and there's a big Baltimore Ravens game coming up. They said, how about if we donate 2 tickets to the winner who happens to register the most in this week? There's a big spike. Main contest is the cash is coming. And as it's closing out, they also said, hey, how would you like a Josh Allen assigned fleet to do this too. So there was another, and so what you can see in our lesson learned is it's so important because people feel it, but doing the incentives are what makes it in the community really happen. So this was our before and after map. We love this photo. Pulse Point uses it too. And on the left, you can see how many AEDs were registered Pulse Point when we started the contest. And on the right, it was how many AEDs were registered afterwards. The cool thing is this is inspiring other contests. So now UB, our university, has taken notice, and we are starting up another contest coming up, getting high school students to be registrars, middle school students a little up in the air because we're not sure of the age. And even the elementary school students are going to be doing a classroom base where all they need to do is see an AED, and the goal is notice where they are and get them thinking about it young before they're afraid. In the middle of all this, because again, nothing is just one pronged here, New York State passed a law, and this was in November of 2024, that led to a lot of fear and what the law stated. And so we in New York State already had some rules in place for CERPs, cardiac emergency response plans, as well as for AED in the schools. But a New York State law came for non-school based camps and youth sports programs that they needed to have at least one person certified in CPR, and they needed to have AEDs accessible to every single location. Now, I sit on a board for a local Little League. We practice in 4 different locations. It's in terrible weather. For those of you that know Buffalo, we can't leave AEDs outside. There's absolutely no way that's going to work. So everybody got really fearful about what we were going to do. And so our county led to a youth sports coalition too, where we're saying, what can we do to help stay in compliance and comply with our goal of making Western New York the healthiest and safest place to play sports in the country? That's our mantra, and that's kind of what we're going with. So following a webinar that we gave last year explaining it, we said, how do we know? People love certificates. So the AHA actually came up with a micro-credentialing certificate that any of our instructors can sign. This does not certify someone to be a lifeguard. It does not certify them to be a CNA, but it certainly certifies them to be a volunteer or a coach on the sideline who is trying to push that needle closer to where we have at the NFL. We formed a partnership with the public library, and this is one we are ridiculously proud of. We now can lend out AEDs the way you would check out a library book. So we already can lend out the teaching kits to teach CPR, but now anybody with a library card, if they've got, say, a family event coming up, or say, you've got a cornhole tournament, or you've got something which may not have the level of event planning like we just heard about, you can go and just check it out, not deal with the expense, not worry about licensing it. They maintain it. You keep it for a week and you give it back. So we're excited about that. We did achieve our Heart Safe designation in May of 2025. So we were excited, and that does need to be redone every year. So we keep working on it. In addition to that, we were talking about the event planning and how important it is. And again, these cardiac emergency response. We have this year's Social Justice Now Community Engagement Fellowship. I've got 2 medical students that are pushing into the community to help Youth Sports League develop the CERPs. The AHA is good at that. They have resources. They have blank forms for someone who was asking earlier. Go to the AHA website. They've got a bunch of kind of plug and play forms to use. But our goal and our lessons that we have learned is to go where people are at, totally use the community partnership. So for those of you that have those athletic training outreach teams, they're motivated, they're excited. They get really proud of what they do, and we have parties to celebrate. And it's a really big deal for us. Foster relationships within the community. So with the Buffalo Black nurses, because people, they may want to do it, but they may want to keep it a little tighter to themselves. Certain places, churches may feel more comfortable if the people they know are coming in rather than a stranger like me. And so with that, we've been really developing the relationships. So I think I talked a little bit about some of this already. Based on the work that we did, Pulse Point now has an official collaboration with 911 in Erie County, so that if someone calls 911, they will be going to Pulse Point. The 911 dispatcher, as they are dispatching the ambulance, will also be checking Pulse Point to see if there's something that can be done sooner. We're continuing our registration. We're continuing our mentorship and our research. And the latest one we're really excited about is, okay, what do we do next? Get the young people involved. So we have another grant for the youth participation action research, which I probably forgot some vowels, but we're going in with a local group called Say Yes Buffalo. They have a subgroup called Breaking Barriers, where it's young men of color from 14 to 24, and they're actually going to do paid internships with us. They're all interested in getting involved in sports in one way or the other, and they're going to become CPR instructors and push into their own places. So that is a whirlwind tour. I could obviously talk about this for 3 hours uninterrupted, but it's just an overview of saying, first of all, emergency medicine and sports medicine is the coolest profession. There is nobody that doesn't get excited when they hear what you do. But we are uniquely positioned because of that to really push into the communities as both helpers and as researchers. And we are always looking for anybody that wants to join us in our efforts to do this. So we're happy to help provide blueprints as we continue to learn. Yes. So one of the partners is our local CARES network advocate, and she's a researcher within our department. And so we've gotten access to all the CARES data with the intent of seeing if things have changed before and after. And it's mostly zip code based. So we're trying to see where we've made the most difference, because it's hard to pull in a lot of the socioeconomic data just based on EMS run reports. But with zip code, you can kind of approximate it.
Identifying where AEDs already exist, or were you introducing them to spaces?
So both, and that's a really cool question, because that's another research project we have going on. Is a student who's looking into the verifiers and what barriers that they had. So imagine a stranger going into your business and saying, hey, do you have an AED? And people are going to get really defensive. So they've learned all these new strategies, such as if you go into a supermarket, they're in certain places, but figuring out how to talk to people, who to talk to, and then you're confirming it with a picture and a good description of that. The next corollary that we just had a nice Zoom meeting the other day with the Pulse Point IT people. We're looking to also figure out where the deserts are, because there's so much funding out there now to put AEDs where they're not, that they're going to use that data to ideally identify AED deserts and get the AEDs located there.
There's a question in the chat that says, this is incredible work. What efforts towards measuring retention retraining are there?
So a lot of the studies that we do have follow-up surveys and questionnaires that involve gift cards. Obviously, you know, that the best we're doing is usually about 53% getting people to follow up. But one, we are doing that to sort of look at the work we've done and how it matters. One of the studies that we did, we were kind of gauging how well they got it after the session. And then they came back 3 months later and did another skills test to see if they'd retained it. And then the other thing is we are continuing to grow and do the same events every single year. So if we're in Juneteenth, or we're in Erie County Fair, or we did a training at a Bandits game, and we do trainings on the Boulevard, which is outside the Bills Stadium, we figure that some of those same people will continue to come back because they found it useful the year before. Yep. So we still are sitting. The meetings have slowed down a little bit, but we still have meetings every other month. And we've got representatives from the county that are able to bring information to us to tell us if they're used or not. All right. Thanks, everybody.